Welcome back. Now, this weekend marks World Malaria Day as the fight to treat and eliminate the disease continues. Malaria still kills a child every minute and costs Africa $12 billion in lost productivity each year. Now, the private sector plays a huge part in combating malaria. Corporate investment helps to protect employees while providing valuable resources like medicine and netting. Well, joining us now is Trey Watkins from Role Back Malaria Partnership, and his organisation partners with countries across the globe in terms of malaria. So, Malaria Day happening tomorrow. Give us an update on how we're combating malaria across the globe.
Well, sure, and thanks very much for having me. It's an important day tomorrow. It's World Malaria Day. It's the last World Malaria Day under the United Nations Millennium Development Goals, which will expire at the end of this year. And we've made tremendous progress, to be honest. Since 2000, we've seen that malaria mortality rates have decreased by 47% around the world, more than 50% in Africa, where we know 90% of the burden is held. Since 2001, we've averted more than 4 million deaths to malaria, many of them young children in Africa. So we've made tremendous progress. That said, you're right, malaria is still killing a child every minute. The WHO, World Health Organization, estimates that there were nearly 200 million cases of infection in 2013, upwards of 585,000 related deaths. We've made tremendous progress, but there's still a lot of work to be done.
So how have you made that progress? Is it down to better education, better implementation? Is it down to countries allocating more resources to combat malaria? What's the main cause for that?
Well, it's a number of things. I think certainly it's increased coordination among partners, and it's increased financing and political will and commitment from the international aid community. But one thing that I really want to talk about here that I think is exciting is also the role that the private sector is playing. And we're seeing that in Africa and parts of the Asia Pacific, corporate investments in malaria are helping to protect employees. It's helping to create more stable markets, and it's helping to unlock additional resources by stretching the value of government spending. But beyond that, we're seeing increasingly that corporate investments or corporate players at the local level are taking on a really exciting role as a local advocacy voice, able to leverage their influence to positively influence, for example, government spending on malaria and local action.
They're corporations, so what's in it for them?
Well, what's in it for them is, beyond being morally compelling, investing in malaria is actually really an economically sound investment and decision. We know that when corporations are investing in malaria, they're protecting their employee base. They're in turn then increasing productivity. They're protecting their bottom dollar and increasing revenue. We have to remember when you talk about malaria, when you invest in malaria, you're not only saving lives and investing in health, you're creating healthy communities. Healthy communities create healthy markets, and you're really investing in entire communities and future generations of leaders.
Are we sure that the medicine that the people need is actually getting to them in its correct form? This morning, for example, we saw a British Medical Journal report that said that actually some of the malaria medicine that's been sent out to some of those affected areas are not as viral as they should be, are not as potent as they should be. Is that true?
Well, it's certainly a concern. And the WHO is doing everything they can to work with countries to make sure that the correct treatments are getting to the communities that need them. One thing that I would say is that, with malaria, it's so much a disease of access more than anything. You see women and children walking hours and miles to local health clinics to be told sometimes there's nothing left to be done because malaria often kills within 24 hours.
Wow.
Or to be told, I'm sorry, but we don't have the stock of the treatment today. So certainly it's something that is of interest and is of concern.
And this is where big corporations can step in and help.
Certainly, big corporations can help to meet the gaps that we have. Corporations can help to meet those funding gaps. They can help to scale up efficiencies. When we partner together, we know we can increase our efficiencies and at the end of the day, maximize our impact.
How else can they do it in practical terms, in bullet points, if you like?
Sure. So there's a number of ways. Certain companies are opting to provide simple employee protection programs, offering their employees more access to prevention, education, treatment.
And it doesn't cost them very much to do that?
It's an incredibly low investment.
Okay.
We're talking about a $10 net, a $7 course of treatment. Other companies like Anglo Gold Ashanti out of Ghana have opted to invest more widely in their community of operation, working with local authorities to develop comprehensive malaria control programs that not only protect their employee base, but also the wider community. The return really just multiplies.
Okay, so lots going on there.
Lots going on.
Listen, we must leave it there, but Trey, thank you very much.
Thanks very much for having me.
Thank you. Next up, is college degree still worth it? You're watching Arise Exchange.